Are you a nurse who finds it uncomfortable having conversations with your patients about sex, intimacy and body image? I'm Charlene Douglas, a psychosexual therapist and intimacy coach, and I'm very excited to announce that I will be hosting a one-day interactive workshop with Fittleworth. The Connections workshop will give healthcare professionals a deeper understanding of sex and intimacy for your stoma patients. All content is designed to help you feel more confident and prepared to have the conversation with your patients, helping them to reconnect with their body and their intimate relationships. Attendance at the workshop can also contribute towards your continued professional development. If you would like to register your interest to attend, please visit the links on the screen. Hi, I'm Charlene, a psychosexual therapist and intimacy coach, and I'm really proud to be working with Fittleworth to support you and your patients through their stoma journeys. You'll know better than anyone that issues around sex, intimacy and body image are really common for stoma patients, but talking about it can be really difficult for you as well as your patient. So in this video, I talk with nurses Julie and Mark about how to overcome your fears about having these conversations. I can start with yourself, Julie. What are some of the intimacy issues that you find that patients struggle with?
I think when the patients have embarked on this journey where their body is changing as a result of surgery, they're absolutely mortified when they look down at the body. They see their body changing, they see this bag on their tummy and they don't feel masculine or feminine. So they immediately want to hide away from society, hide away from their loved ones and not really talk about the issue. If the healthcare professional or their nearest and dearest are avoiding the topic, they're not going to bring it up. And then it becomes a bit of a snowball. So they then start to hide away, start to wear baggy clothes, keep the distance from their loved ones, which at such a time when they need the emotional support is so wrong.
Yeah, so I suppose what you're saying there is that although there's an issue with their physical health, that actually this can potentially impact their mental health as well, not having intimacy in their lives.
Absolutely. I mean, we all know how important that big hug when you're upset is. If that's taken away from you and you're on this journey, be it for a cancer or an irritable bowel or whatever, you need support, and that hug is really important. If you shy away from it, if you push your nearest and dearest away, then who's going to give you that support? I've spoken to people before now and said, you know, let's just have a quick chat about intimacy and the body image. And they, more often than not, you will hear the patient say, oh, I'm not bothered about sex. I'm not talking about sex. I'm not bothered about it. I don't bother anymore anyway. So I do always say, well, you might not want to now. You might not feel like it now, but 6 months down the line, you may, and it may be an issue by then. So why don't we talk about it now?
Yeah, that's a really great way of broaching that kind of topic because, of course, they're going through so much at that time that sex might be the last thing on their agenda. But of course, we're not just talking about sex, we're talking about emotional intimacy as well. So, you know, being able to connect with one another on a deeper level so that you don't feel so alone in this journey. With regards to some of the sort of sexual issues that patients might be experiencing, what have you noticed, Mark, in your practice that, you know, some of the intimacy issues that people are sort of going through?
You can have intimacy issues like you can have sexual dysfunction, you can have erectile dysfunction, you can have dryness, but also we want the patients to kind of think about the positions that they might want to do intimacy in, sort of the pouch that they've got and the stoma bag and everything, how they're going to look after that. Do they need to empty it first? Do they need to cover it up, or would they like to cover it up?
So some really private situations that occur for them that I can imagine is quite difficult for them to speak to you about.
It can be, and it's kind of broaching those and kind of opening having opening conversations and having opening questions that they can then kind of come to you, or that you start that conversation regarding intimacy or about any of their issues that they're having.
And of course, that's because some of these topics are topics that where there's a lot of stigma attached to them still. How do you then cope with that as a nurse? Because that must be quite tricky for you.
I think it's just maintaining and trying to be professional and kind of not necessarily taking cues of what's going on around. You might be in a noisy environment, you might be on a ward or something, you might be in a clinic room where you've got other people around, but kind of trying to centre into that patient, listen to the patient, look at the cues of what they're giving you and things, and trying to kind of be open to what they're doing and not putting what you're thinking necessarily over onto them.
Yeah, absolutely. And I think what's really important here is to think about the fact that you may still be nervous and a bit uncomfortable when you're having these conversations with the patient, and that's fine because you're human and you're allowed to feel how you're feeling. But I suppose it's what's then potentially projected into the space with the patient that you have to be aware of and make sure that it doesn't impact what they want to say to you. And I imagine that that's probably the tricky balance for a lot of nurses in terms of how do I make sure that my stuff isn't caught up with the patient's experience and what the patient wants to say.
And also giving them the time that they can do it and kind of come to it. It's a difficult subject, isn't it? It's a difficult kind of subject to have in quite a short space of time. So it's building up that rapport as quickly as you can to then possibly not have that conversation at this session, possibly come to a different session or give them the information or signpost them to something that they can have a conversation with something else.
Absolutely. And you mentioned rapport there. I think that's really important because it's probably quite difficult to build rapport in a short space of time and talk about a topic that has a lot of stigma still attached to it.
Yeah.
So is that something that nurses find to be quite tricky, quite difficult?
I think every nurse has their own way of doing it. Like humour plays quite a lot of it with me. I will try and kind of lighten the mood by humour or taking the cues from the patient and things. All of us have our kind of own way of strategizing how we're going to have a difficult conversation.
Yeah.
And it's making sure that you're not that one person that do it. Is you've got a team around you. Are you the appropriate person to do it? Is someone else a better person to be having that conversation? And just knowing sometimes your own limitations when you're doing it.
Absolutely. I think those are really important points. I think what I'd add to that as well, though, is the importance of being prepared as well. So if you know that you're someone that feels quite nervous when you're speaking to a patient about these types of topics, to make sure maybe that you've got visual aids to refer to, or you've got websites that they can go to when they go home. So it just takes the focus off your discomfort and instead helps them to start thinking about where else they can go to get the support and help that they may need. As a stoma nurse, you'll be aware that coming to terms with a stoma can be difficult. And that's why Fittleworth have asked me to create the Connections Toolkit, 6 tried and tested tools that help patients reconnect with themselves and their loved ones after stoma surgery. More information can be found in the Fittleworth booklet, Connecting with Yourself and Others. It's important to remember that this and all the other tools are not guaranteed to fix your patients, but to support them on their journey and to give you some tools you can suggest if you notice your patient is struggling to cope. If you think they need more specialist mental health or crisis support, then always refer them to relevant services.